And a Kiwi doctor is presenting what are being called breakthrough developments in the treatment of Parkinson's disease to an international conference in San Diego. Dr. Barry Snow is sharing his findings from a trial involving 4 patients who've had capsules containing thousands of pig cells implanted into their brain. Patients who've taken part in the trial, the 4 of them, are describing the treatment as life-changing, all 4. Otago University Associate Professor of Neuroscience, John Reynolds, specialises in Parkinson's research and has been looking at Dr. Snow's findings and joins me now. John, good morning to you.
Good morning, Paul.
Dr. Snow is a colleague of yours.
Yes. Yeah.
So we're talking about a trial involving only 4 patients, but they have all experienced a phenomenal benefit from this treatment.
That's pretty good, isn't it? 100%. So I think we can be very cautiously but enthusiastically optimistic. I mean, this was a small study that was designed to really find out if it was a feasible treatment to do, and they found that out. That met its endpoint. And they also found very happily that they have some clinical improvement as well. So that sort of sets us up for the next stage, which is a proper phase 2 trial.
And you know, what's important here is that you are excited about this.
I am very much, yes.
You know, the scientists around the world are excited about this, and you are from a group of people who are very reluctant to show any excitement.
Yes, I've got to say cautiously optimistic, because one has to find how the research comes out. So I mean, the next stage is really seeing how good it goes compared to conventional treatment.
For a layperson like me, can you tell me what is actually happening in the brain?
Yeah, so in Parkinson's disease, what happens is there a part of cells in the base of the brain that make this chemical dopamine. And dopamine's a chemical that we think of in terms of reward and excitement and reinforcement, but it also, when we lose it, we lose our ability to move. So people with Parkinson's, it's very common. So 1 in 100 people over 60 years old have Parkinson's, so about 10,000 in New Zealand. And of course, we have an ageing population, so it's sort of, we've got the tsunami of ageing. And what happens is people can't move as well, they can't express themselves, they lose the ability to think, and they're very depressed is often a sign too. They don't want to get out of bed in the mornings, they can't. So anything that can enable people to be able to get back and get the quality of life, because you don't necessarily die from Parkinson's, you can live for many years. So Michael J. Fox has had it since
and
the
that
30s,
arguably is one of the cruelest things about Parkinson's, isn't it? Yeah. And so basically these pig cells in a capsule form, what are slow release, they're put into the brain and they slowly release.
So they don't actually replace the neurochemical, which is what the exciting thing about this is. What they tend to do is they tend to try and repair parts of the brain that have been affected by the loss of dopamine.
So your body actually manufactures.
Yeah.
So your body starts to work normally in that area.
These cells, what they do is they make these growth factors. They actually sit there and make growth factors that we have a need for our own brain. The neat thing about them is you don't need to be immunosuppressed like people do with grafts. You know, you have to you have the suppression. You don't with this because they're in little capsules. So the body, our brain, doesn't see those pig cells.
So they're protected from the defence of the body.
That's right. Yeah.
Now the interesting thing here is that, as we say again, there are only 4 people that have tried this, but they have experienced improvements like the use of fingers again, the use of limbs that they'd lost the use of.
I thought the person on the news the other day who'd received it, who said she's got her joie de vivre back, was quite amazing.
All right, so say I've got early onset Parkinson's, or someone listening or watching us now has it or has a family member with it. What does this discovery mean for them in real terms?
Right, in real terms, I think we have to wait and see the research, obviously, that comes out, the further. But
I suppose what I'm saying in the first instance is how long before anything is available?
It's very hard to say. So they've managed to get where they have in 3 years, which is pretty impressive. I think 3 years from when they started, or they got the first results of the animal trials. But I think you could see another phase 2 study. It depends how they design it in 2 or 3 years, and they want to advance it from there. So people could be potentially recruited for the phase 2 trial.
So this could actually make a real difference for people in early onset Parkinson's.
I don't know that
in
it
a
would
few
be
years' time.
Early onset. You know, I think these are people who have failed drug therapy. So basically, there's a limited number of years that one can have good treatment from drugs.
Right.
So I think it's not going to be your front line. It requires a surgical treatment.
So watch the space.
Yeah, I think so.
Brilliant. John, thank you so much for joining us. John Reynolds, Otago University Associate Professor of Neuroscience.